Director for Parkview Health System. And why am I an infectious disease doctor? Well, it's been said that doctors tend to pick the specialties that help confront the fears that they have. So I guess I have fears about bugs, and that's why I went into that and find it fascinating. It's like neurosurgeons, you know, are worried about strokes, and cardiologists are worried about hearts and MIs, and oh, I don't know what excuse male OBGYNs have. So, just like church, we're going to begin with a reading. Now, I'm going to say, as being an ID doctor, one of the things that just fascinates me is books on infectious diseases, particularly those I don't see so much. So one that I just have found as being the very best is called Guns, Germs, and Steel by Jared Diamond. And I just can't tell you how much and how enjoyable that book is, looking at how disease has affected the course of humanity and of civilizations and has really changed the course of history. Another one is Viruses, Plagues, and History by Michael Oldstone, and I'm going to pick up with a reading here. They talks about you need 2 doses of the MMR to get adequate immunization. We talked about that already, and so he said the rub is that for either religious or individual reasons, those doing homeschooling can, by design, escape this regimen of vaccination. An additional stumbling block is misinformation that attributes disorders like autism to the administration of the measles virus vaccine. Regardless of the reason, refusal of protective vaccination encourages a breeding ground of susceptible people primed for the infection and spread of measles virus whenever or wherever they are exposed. Even though 95% coverage of the population they enter has interrupted the circulation of the measles virus. In just such a setting, a severe outbreak of measles virus infection erupted in northwest Indiana. Mainly in Tippecanoe and Clinton counties, there a group of folks refused vaccination for a multitude of reasons. Some were simply apathetic from not witnessing anyone with measles for years. Others could not understand scientific information or reconcile it with personal experience. Religious beliefs or strong individual concerns that government should not be trusted with decisions about vaccination deterred still others. Some thought that the children received too many vaccines, inaccurate advice from alternate healthcare sources to not vaccinate was convincing. Thus, many had opinions, but few had facts. Preceding the Indiana epidemic, a group of unvaccinated church members, many of whom homeschooled their children to avoid mandatory vaccinations, sponsored amongst their charitable works a visit to a Romanian orphanage. Joining them was an unvaccinated 17-year-old girl from a missionary group. Although measles vaccine coverage in Indiana was 98%, but it's not now, measles virus infection was epidemic in Romania. The girl became infected in Romania, incubated the virus on the airplane, carried her back to the home in Indiana. There, the virus she bore attacked and infected 34 susceptible individuals gathered in church to hear a report of the missionary work. These 34 cases constituted the largest epidemic of measles in the United States since 1996. Genetic profiling of the virus substantiated that it originated in Romania, thus a virus from outside the United States transported rapidly across several countries and infected citizens of an otherwise measles-free region. The first victim was a 6-year-old girl who was hospitalized in Cincinnati 14 days after attending church gathering. And of the 34 cases, 32 had not been vaccinated, 94%. And the vast majority were infected under the age of 20. Of those afflicted, 71% belonged to just 4 families. What year was that?
2016.
2016, okay. What, other guesses? Anybody else? 2018. Others? Well, it turns out that this particular one that he was talking about was actually 2005. Though, the things that you said aren't inaccurate. Who knew? Who knew the Amish traveled to the Philippines? Who knew? 400. Turned out that it started in one county in Ohio with a small group of about 100 people, and then they decided they were so successful that time that they took yet another group and another group and another group and started to pull from not just an Ohio county, but also from Indiana, and led to one of our outbreaks here. Another one was a guy who decided to go on a missions trip and take his unvaccinated child, who then came back, and not only did the child develop measles, but also the sibling that was partially vaccinated. But to the answers for the other years, yes, we don't seem to remember, we don't seem to learn the histories of our past. And those who cannot remember the past are condemned to repeat it. So I find this frustrating, but I think that it's rather an incredibly interesting thing for me, as I am actually had a studied history, and I have a minor in history. Thank you very much. In part because I just find this so fascinating. And that brings me to this. The one lesson we've learned from history is that we have not learned any of history's lessons. And as you look at other countries and the problems we're having with Ebola, and the fact that there is higher distrust of the healthcare professionals and killing of healthcare professionals trying to save their lives, and that they trust myth more than they trust fact, and how there's such an anti-science belief within not just our culture but other cultures. Guns, germs, and steel. The major killer of humanity throughout our recent history, smallpox, flu, tuberculosis, malaria, plague, measles, and cholera, are infectious diseases that evolved from diseases of animals. Even though most of the microbes responsible for our own epidemic illness are paradoxically now almost confined to humans. Rinderpest from domesticated cows. We're talking not, Holsteins. We're talking about the ones that when man first started living with animals, with initial domestication thousands of years ago, and that it turns out that the nasty epidemic disease affecting cattle, rinderpest, and many wild cud-chewing mammals, but not humans. Measles, in turn, doesn't afflict the cattle. The close similarity of the measles virus to rinderpest virus suggests they were transferred from cattle to humans and evolved into the measles virus by changing properties to adapt to us. The transfer is not at all surprising, considering that many peasant farmers live and sleep close to cows and their feces, urine, breath, sores, and blood. Our intimacy with cattle has been going on for the 9,000 years since we domesticated them. As we look forward, we must look backward to understand and help predict what the future is going to look like. I was born in 1962, September, in fact. The first vaccine licensed in 1963 did not keep me from becoming infected with the measles virus, though this child is a lot cuter than I was. You can see perhaps some of the spots, and more importantly, the coryza and the conjunctivitis that go along with this. It can be dangerous. It is, in fact, one of the more deadly diseases known to man, and in the past have been responsible for an incredible burden of disease. Most often confused with anything, it's going to be confused with chickenpox, and those of us who have received phone calls from the emergency room, I think they have measles. This can help determine the difference. Fever with measles think 104, 105 degrees. So how high is the fever? Chickenpox can be higher, but typically it's going to be a much lower fever. It's going to start here on the forehead, okay, as opposed to on the chest or on the back with chickenpox. Conjunctivitis. I mean, if you don't have a kid with conjunctivitis and they have a rash in the emergency room, it ain't measles, okay? And so I think that's really a very good discriminator when you're taking that phone call. The runny nose, the hacking cough, then the spots, the gopic spots, as opposed to the classic dewdrop on a rose petal that one sees with chickenpox. So we see this morbilliform rash here on the back here. This is the mouth and tongue, and you can see this is actually the tongue is down here. This is the buccal membrane. Here's a strawberry tongue and a face, little girl. Again, notice the eyes. Notice the eyes. So, does this vaccine work? Hell yeah. I mean, look at this. I mean, this is just amazing. We talk about something that has the impact for human life. And prior to when I was born, there were thought to be 3 to 4 million people infected a year. Only 500,000, half a million people were reported to the CDC, but there are 400 to 500 deaths a year. So you're talking about 2 airplanes crashing every year, killing all aboard. 48,000 hospitalization, 4,000 cases of encephalitis, 2,000 people so severe that they have to go into an institution and can't take care of themselves. A year. A year. Even if you pass through that, it's amazing I am where I am. You know? How did I not end up with some of this? But even if you make it 7 to 10 years later, you might find your brain is being rotted away with this other disease, subacute sclerosing panencephalitis, where it literally destroys, rots, corrodes your brain with viral inclusion bodies, causing deterioration of the neurons, initially presenting as behavioral intellectual deterioration, onset of seizures, and then inability to really move or function, institution, death, young age. Well, if we just didn't have those foreigners, right? Let's build a wall. That'll take care of it, okay? Yeah, no, it's not our foreigners. They're not the ones that are really doing this. None of the recent outbreaks we've had here in Indiana at all have been attributed to foreign-born individuals. They're U.S. citizens that magically believe that they can go to the more wild portions of the world and not escape the hazards that lurk there. And that might be Mexico. Okay? How many people are going down there and think that they're immune to hepatitis A and don't realize that even if it doesn't kill you, and 2 to 3% of people will die, it's likely going to put you out of work for 3 to 6 months. Yet, how many people are signing up to go down to Cozumel or to anywhere else down there? I mean, come on. Yeah, we don't have respect. We're not taught respect for the rest of the world and the hazards that lurk. But we know, we saw, look, hey, the measles cases have tremendously dropped down. We've had a few blips as we tend to forget the past. But then things get better, and we're heading towards that 0 mark. We just have a small handful of cases. How do we do compared to the rest of the world? Well, be perfectly honest, we suck. I mean, look at this. Children not given their first measles vaccine. The United States has like 2 million people that didn't get vaccinated, whereas France is down around 608. 500,000 in the UK, Argentina, my God, Chile's even better off than we are. Despicable. So where are the number of globally reported measles cases? Where are their problems? Well, we're having an enormous problem in the Philippines right now. And the message for you to take home to anybody, particularly those who are going on a missions trip in the Philippines, is that they stopped vaccinating for the most part for the past 10 years. It is incredibly dangerous to go to the Philippines and not be fully vaccinated. And when I say fully vaccinated, even those, as we talked about, those of us that have already had 2 doses or wild-type disease wane over time. And if you're going to go to a high-risk location with a risk of death, take the darn $15 for the $45 shot. I mean, come on. It's not that expensive. And an ounce of protection, pound of cure, this is really quite the ounce. Well, you can see what countries are at really high risk, and part Ukraine, another one, India, Madagascar, Philippines, Brazil, Pakistan. Venezuela used to be one of the best in the entire region and is now becoming the worst. Yemen, Thailand, Israel. 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 A lot of people go to Israel. Have respect. 764 cases yet. That's not enough. It gets worse in 2019. This is actually the most recent data for last night. And it's now saying we're at 1,164 cases, and you can see all the deeper blue states where it is. What's more amazing is where it's not, really. Though it stands to reason, and those states that are now passing mandatory laws that not only can you not go to school, you can't homeschool, you can't do anything unless your kids are immunized. That's really where we need to be legally. Well, how are we doing locally? We've got data from 2018. Here are the 10 lowest rates by county. Thank you very much. And what's in our service area? LaGrange, 49%. Crawford, Allen, 58%. Okay. And look, we're talking Indiana's 67% compared to the national average, which is closer to 93, 94%. I parsed this out, so I apologize, and I don't mean to go through this incredible number, but this is easily available by just Googling it on ISDH website, and it's the same. I've got the reference on other slides, which I'm more than willing to share, but you can find your county, and you can find how we're doing in terms of the completion rate, and for instance, Allen County here, 58%, and get some kind of an idea. You know, is this a problem? Oh no, this isn't a problem. This is a crisis. Because this is going to have an incredible impact on our workforce, not to mention our social system, our social support system that's paying for all of these people who are going to be so terribly disabled. So what about this MMR? Is it any good? How's it made? I'm vegan. I don't get, well, okay, you can be vegan and you can die. It is made with chicken eggs. It is largely purified. However, it does in fact use a chicken egg incubation, as does the rubella. Rubiola actually uses an immortalized cell line propagation. Oh, I don't want anything with human tissue. Well, there's lots of things you get with human tissue, and this is one of them. And it is, again, an immortalized cell line. It is not using fetuses or anything of the nature. It is from the WI-38 human diploid lung fibroblast, which was actually a cancer transformation that immortalized the cell line back in like the 1960s. So that's where this came from. It does contain neomycin and gelatin, and everybody keeps talking about gelatin. Gelatin, what about gelatin? I eat Jell-O. I don't have a reaction. Who gets a reaction to that? Well, people do, and people do anaphylax. It is a thing when I talk to my allergist. So for people who have concerns, the allergists actually have an incredibly good series of tests to look through and find out, are you truly allergic to neomycin or to gelatin or to some other component of the vaccine. And not only this, but influenza or any other vaccine. And let me go off on yet another tangent. We talk about these. These are really incredibly safe vaccines, such that really when you look at how many people have truly been harmed in the past 10 to 20 years, we're talking about a pitiful handful. Of the 800 to 1,000 people have actually claimed money from the vaccine fund. The vast majority, nearly 2/3, had at best a temporal association with little to no supporting documented evidence. But that fund has gained so much money, they're sitting on it and they're trying to figure out, well, we got to do something with this money, we'll start to give it to some people. But we'll chat about that in just a minute. So this is an interesting slide. It really has probably played better when I was looking at it last night than today. Looking at what was in 1923, that 1,560 had tetanus, and now we have 37 people with tetanus. But the effects of different vaccine, 152,000 contracted mumps in 1968, and now we're talking 229, and that more people get struck by lightning than have infections of some of these things. I thought that Vinay Gupta had an interesting comment. There is no plan. There's no actual grand narrative. Think about what has happened later, but live, learn, and act in the now. Look into the dark corners that narrates that narratives want to forget and that make you uncomfortable. Don't ignore the truth just because it doesn't agree with the world you want, because it's the world you're going to get. And that's really my sentiment to those who are anti-vaxxers. Understand, this is the world as it is, not your idealized, stylized world. Bugs don't care. They will kill you. So the vaccine, National Vaccine Surveillance Safety Programs overseen by the CDC and the FDA, and they collect and analyze everything that gets put in, any kind of reaction that occurs, and they get about 30,000 reports a year. Sometimes it's true that there are vaccines that cause trouble, and that it isn't until after it's been in production that we see problems. We talk about these vaccines. People are up in their arms about MMR. They're up in arms about flu. Those are amongst the safest things we got. How many people complain about the hepatitis B vaccine? That's one that can cause harm. The new Heplicab vaccine, again, we're waiting for the complete safety data set, which hasn't been completed last time I looked, even though it's now entered the market, can cause granulomatous disease and trigger autoimmune diseases. Okay? And let's not forget about the Lyme disease vaccine, had to be taken off the market because it started to kill people. Okay? Or what about the yellow fever vaccine? If you're getting to be an old fart like me and get yellow fever vaccine, it can kill you. Okay? I mean, we have vaccines that cause harm. There are real ones. And those are the ones that worry me. Not MMR, not flu. Those are really benign. And you can get some kind of an idea here in terms of the court decisions that were made versus the concessions, the one where they just rolled over and said, well, maybe. And then there are some settlements. And so total number of cases that you have down here, the compensation total, the number that were compensatable were about 3,597, of which 1,723 were dismissed, for a grand total here of about the number of doses distributed, 3 billion doses distributed. And at most, you've got something, at most, you've got 5,320. And most of those were bogus. So when you talk about real ones, you're probably down to around 800. 803 billion doses. So anyway, that is really, people wanted me to talk a little bit about history, and that's my thing, which is why I wanted to talk about that. I could talk a little bit about what to do if measles shows up on your doorstep. I could talk a little bit about other aspects, but really was interested to see what was on your mind. Yes?
How do you deal with folks who don't build antibodies?
Okay, what happens when folks don't build antibodies? You know, there is a wonderful concept in medicine called herd immunity. And herd immunity is what we rely on to protect those few people who can't build antibodies. What if that person wants to be an ICU nurse or a NICU nurse? Okay, so what we do at Parkview is if somebody is found to have an immune compromising condition such that we become aware, and we don't seek that data, but perhaps we're being told, then we have a group of people that will convene, of which I'm one in that board. So for instance, if somebody's found to have hepatitis B, hepatitis C, HIV, we look at their job category, or if they're immune compromised and they have a potential life-threatening job. Okay. This board will take a look at them. We don't know their name, but we look at their job description, we look at their disease, we look at their critical numbers, and then we help provide advice to the ultimate determining body, which is in our employee health physicians. And they're the ones who have all the data, including the name, and they've interviewed and talked to the employee, and then decided, yeah, this person's safe to go back to work, or they're safe to go back to work with these restrictions. Their hepatitis B load, viral load has to be below X. Their CD4 count, if they're HIV positive, has to be above Y. You know, they make those levels and then they monitor them over time.
Well, what about measles?
Well, what about measles? Okay, so
8 shots.
Okay, so I've had 8 shots and I don't convert. That's a different question. So for the question really revolves around, okay, I've had 4, okay, just saying, and I had real disease at age 1. It turns out there's 2 things that are going on. The first is the test that we have for measles antibody is poor. It turns out that that's an EIA test, and we have never really developed any of the new molecular methodologies to determine appropriate antibody levels. And that in about 30% of people who are negative, that they actually have adequate antibody levels if you use other experimental processes to determine those antibody levels. At the same time, as we get older, the antibody levels start to drop off. And so there are some people who have been vaccinated or had 2 vaccines or had real disease, and their antibody levels diminish appropriately. Because of that, if I'm going to go to if I'm going to the Philippines, I'm going to get boosted, even though I got boosted when I started here 6 years ago, my 4th booster. So, yeah, it happens, and there is flaws in the system, but that's down deep in the weeds. The antibody test to detect is not all that hot. What I would say is if you've been through one molecular assay process, find out what one was used, and see if you can go to a Quest or some other place and see if they'll use a different method. Your employer should be willing to pony up for that. Great question. What about immunocompromised people? Can they receive vaccines? Well, clearly, torch syndrome, pregnant women have a very legitimate reason why they should not be vaccinated while they're pregnant. Okay? After they deliver, they should not be exempted, particularly if they're healthcare workers, and they should immediately get vaccinated after that. But there are people who are immunocompromised, and as a physician, I'm going to take a look at their degree of immunocompromised state, and I'm going to weigh that risk against the benefit. The average Joe Schmo works as a plumber, not going to go to the Philippines? Not so terribly interested. The guy who's going to be a missionary and go to the Philippines? Well, and he's on Remicade, something like that? Yeah, we're going to wait till your Remicade's ready for the next dose, and right before that we're going to go ahead and give you a shot, maybe 5 to 7 days before you get your next dose. Or hold the next dose of Remicade for a month or something like that. And just, I'm gonna work with that individual, but I have to do that risk-benefit analysis and put that in the chart so it's very clear. I had that discussion with the patient or employee and why we've made the decision that we did. Oncology patients, yeah, not too worried for the most part. Bone marrow transplant, well, if they're a new bone marrow transplant, yeah, they're a petri dish. I'm not going to really want to do them. So, again, you have to make a risk-benefit analysis. But that's what we do, right? Oh, I couldn't have been so elaborate to have answered all questions here. Yes?
So how am I going to find out if I want to go to XYZ?
Okay, so I'm going to go to maybe the Philippines, and I want to know if I'm still got adequate antibodies, right?
No, what do I need to get?
What do I need to get?
No,
Well,
I'm just
you know,
saying, the travel companies aren't going to say, you need this, this, and this.
oh, you're right. The travel companies have no interest whatsoever to bring up the fact that there might be risk for what you're planning on doing. The wonderful thing is, here in Allen County, we have a travel clinic, and that's located down at the health department. And I would strongly recommend that you schedule to see them, preferably about 6 months ahead of when you're planning to go. Particularly if you're going to Africa and might need yellow fever vaccine, or down to Brazil or someplace. You absolutely have to allow time, because it's a nationwide, actually in United States-wide short supply, and it may take some time to actually get a dose in. And if you go to some countries, you can go. You can't come back out. Okay, just saying. You didn't get a yellow fever vaccine, you are not coming home. So think about that. But yeah, what I would do, absolutely, I would go down to the health department. I would go to the travel clinic if I were planning anything like that. Absolutely.
Just so you all know, the reason we even have a travel clinic is because a lot of people go on missions trips, and they kind of shortchange themselves because they're paying for their own ticket to get down there, they're sending a family down there, and so our vaccinations and antimalarials are at cost, and that's the reason we do it, because we want people to go do your good works and then come back and stay healthy. So when you hear about people who are like, obviously we'll see anybody, but if you hear at church or other places where people are going on missions trips, let them know that we do that, and you can be out of county, that's fine. But it's really important, as Dr. Steinecker said, some of these places, I just really don't even know why they're going, but they can be really scary where these people are going, because we don't have vaccines for everything. We don't have, so you really got to be on guard when you travel. But just let them know that's a low cost, it's not going to be cheaper than what we do there, and you'll be safe and have a good time.
Given the cases that we report, it's been absolutely shocking to me how many people from our region go to China and Philippines and Thailand and just sort of all the high-risk places, and how many missions trips. How much? Who knew? It blows my mind. But they do. Well, hey, thank you. I appreciate all your time, and hey, can't recommend enough. Boy, if you got something on your reading list, Guns, Germs, and Steel, fantastic book. The second book was Viruses, Plagues, and History by Oldstone. So they're cheap. You can get them on Amazon. These are not expensive. Anyway, thank you very much. I hope that was entertaining, if nothing else. Next, I'm going to go ahead and introduce Erica Pritchard from the Health Department to talk to us about a whole bunch of different things.